Good morning. Thank you all for being here today. It is a pleasure to kick us off on our Greater Miami Chamber of Commerce webinar focused on building healthcare and community resilience, where we will be highlighting the topic of disaster preparedness in South Florida. This is an important topic for both the healthcare and resilience committees at the Greater Miami Chamber, and it's been a pleasure to collaborate across our committees. And again, welcome to members and non-members alike. We want to make sure to recognize FPL as our sponsor. FPL is not only an essential and critical partner in disaster response and recovery, but also in the planning efforts. And I want to just go over a few housekeeping items for today before we get started. So you will all be muted during the call. The speakers will be featured on the screen when the panel comes on together. And there is a chat feature. We welcome you to engage and network in this feature. But if you do have specific questions, please use the Q&A function at the bottom of the screen. And if you have a specific question for a panelist, you can name and provide the name, or for the panel in general. And so again, use a Q&A feature when you have a specific question, and we will make time at the end of the session or the webinar to take your questions. Also at the end, there will be a QR code. We have some resources for you. We'll go over those at the end, but we'll save those and it'll be available to you for additional learning and resources. I want to take the time also to turn it over to Lynette, who has a few words as well.
Yeah, thank you. Good morning, everybody. I'm Lynette Cardoche with Moffitt and Nickel, and I'm the chair of the Resilience Committee. And Evelyn, thank you for, co-hosting this event with us today. And, when we think about resilience, we're always looking at it from the lens of it being operational continuity, business continuity, whatever that might be. If you're in the business of running healthcare or, community services, whatever that might be. And part of the magic happens with events like this when we have that collaboration and we have the dialogue between our committees. And a few months ago, we held one on cyber technology, cyber resilience, and now we're moving along to be able to partner with the healthcare committee to continue that dialogue on preparedness. And so very exciting that we continue to have this collaboration. And with that, Evelyn, I'd like to hand it back to you and hope to see folks at our summit in May for the Resilient Solutions Summit. I encourage folks to use the chat. It's always part of the exciting parts to capture your ideas along the way. Thank you.
Thank you so much, Lynette. And I echo your words. It's been a great collaboration. I want to make sure that we keep us on track. So I'm going to get started. I have a very short, brief intro before we turn it over to our experts, just framing the strategic landscape and why preparedness is a leadership imperative. And it is great pleasure for me to be serving as the chair of the healthcare committee. And healthcare is not just a critical aspect of our industry, but the partners in this landscape are also so important. So it's great. I'm sure that we have representatives from different sectors and collaborators across our community. Next slide. So this topic continues to evolve from an operational focus to a true leadership priority. We have predictable disruptions in South Florida, many that are familiar to us. We operate in an environment where challenges are not only they're unexpected, but they're also expected. We have areas of opportunity where we can learn, and it's part of the planning. So it's really a reality for us. What's changing is the frequency and the complexity sometimes, new entrants or new introductions, such as cybersecurity that is becoming more and more important in our landscape. It really raises the bar for all of us across the different sectors to collaborate and not only reacting, but planning for these disruptions. Next slide. So we've all seen this, right? These are very familiar to us. Many of us plan for some of these for example, Hurricane Irma. And we know that different communities were affected more critically than others. So it's important to have not only that this is not hypothetical, but we've experienced it at this point. And it's, again, as I said earlier, it's becoming more complex and more frequent in some aspects. We have moments that are highlighted here that were critical to coordination and preparedness. And we've endured it and collaborated and came out stronger because of it. They really provided valuable lessons that we continue to learn from and shape the way that we react and plan for these disasters. Next slide. So why preparedness matters? It's really is where it becomes very tangible, the planning efforts. It touches nearly every aspect of every organization that we work for, from our workforce to access to care. It is also real implications for continuity, financial stability, and community trust. We've seen that with some of the supply chain disruptions, for example, that we experienced in the last year or so. Ultimately, this is about how we show up for our teams and for the communities that we rely on, and how we rely on our experts and some of our expert panels here that are such important parts of our ecosystem. And so with the next slide, we have our really what resilience requires. And we have our emergency management professionals that are critical to this. And we have different sectors also that are represented in our panel today. And I mentioned our host or our sponsor, FPL, who again is a critical partner in this effort. It really is about the collaboration across the community again in the sectors. And healthcare resilience is regional. There is no single organization that can do this alone. And again, I'm very proud and honored to be able to assemble this team together, and many of you that are doing this work day to day that are here with us today. Next slide. So very proud and happy to introduce our panel, which will be following just in a minute. Very proud of Bridget Pelaez, who's been a critical and very engaged member of our healthcare committee and a great leader in our community. Bridget has been very active. She served as a judge in our Healthcare Heroes and really provided such great insights to our team, to our community. And so Bridget, I'll introduce her and then we'll get started. Bridget is a healthcare executive and disaster preparedness leader with extensive experience in emergency management and health system operations. She is a board-certified family nurse practitioner and serves as Senior Director of Disaster and Emergency Preparedness at Jackson Health System, as well as Deputy Team Commander for Federal Trauma Critical Care Team. With over a decade of federal deployment experience, she has led the development of ICU and surgical capabilities during large-scale emergencies. Her work focuses on strengthening healthcare resilience, advancing readiness, and improving care for vulnerable populations. So now I'll turn it over to you, Bridget.
Thank you so much. It's a pleasure to be here this morning. So I know we have a slide, and I just want to touch on it a little bit and say good morning to all of you for being here. So response to resilience. For those of us that have been in the field for a long time, we're very familiar with emergency plans and operational tasks. And it's sort of something where we say, do you have your binders? Are you checking the boxes? And in the field, that's a term of, yes, we're checking the boxes, but that's no longer good enough. Now what we're talking about, and we're having broader conversations, and I have friends in different industries, and the conversation is, what is your continuity level? What are your resiliency? Are you actually thinking beyond immediate response? And I like to see this because the term is more strategic. It's what is your resiliency capability? And this isn't just in the healthcare sector, it's in emergency management, it's in our communities. It's asking ourselves, if I lost that great brain person, where would I be? Would I be able to continue? And in healthcare specifically, and in South Florida, I can say that it starts with regional coordination. And the way that we do that is we bring together all the hospital systems, but with emergency management, and also with the private sector. So I think the panel that we have here today is going to be able to have those conversations, and we're going to be able to talk through it. But operational task is day to day, and that's what our operators are doing, right? But leadership needs to have a buy-in in that process. So it's not just an operational issue, it becomes now a leadership priority. And we are seeing that shift even with our, standard organizations or accrediting bodies. So Joint Commission is seeing that. Now we've shifted over to the national preparedness goals. And I'm sure even you're seeing that in different accrediting agencies, in higher education or in different business aspects. So it's a shift from reactionary to resiliency, and I'm happy to see that. So I think what's going to make today's conversation so important is that preparedness is no longer just an emergency management function. It's a healthcare priority, it's a business continuity issue, and ultimately it's a community resiliency strategy. So we have an outstanding panel representing emergency management, healthcare systems, regional coalitions, and the private sector. My goal for today is to move us beyond general concepts and into practical insights to see what's working, where the gaps are, and how we can adopt a mindset that perhaps gets us to think that we can't predict every disruption or disaster, but maybe we can control how we respond to them. So if it's okay with everyone, I'd like to get started. I'm going to ask the first question to Pete Gomez. To start us off, Pete, given your extensive experience in both public safety and emergency management, how do healthcare systems and emergency management coordinate before and during disasters?
Good morning, everybody. Pete Gomez, Director of the Department of Emergency Management for Miami-Dade County. It's a great question, Bridge. And I was listening to everything you were saying. Like, preparedness does not just happen, overnight, right? It's an ongoing thing. People say, okay, you got to start getting ready for hurricane season. I would say there is no hurricane season because, as you've seen in the last few years, we got flooding events, we got extreme cold, we got extreme heat, we got all these things that keep impacting us, and we need to be ready. So, what I see as far as preparedness, one of the great things that we have here in South Florida is that collaboration, right? That most of us here, we know each other. We do drills all the time. We have meetings. We do exercises. Um, the whole regional domestic security task force concept is so important because it brings every discipline together once a month, quarterly, and we all talk, right? From every discipline, right? Police, fire, hazmat, SWAT, maritime interdictions, all these things that we are constantly impacted by, we get together. So I think that's big time as far as the whole preparedness cycle that we have here in South Florida.
Thank you, Pete. So building on that and coming from a statewide and regional healthcare coordination perspective, I think I'm going to you. Marilia, can you introduce yourself and explain what role do hospital coalitions play in disaster readiness and response?
Morning, everybody. I'm Marilia Van Keeken. I'm the Deputy Director for the Miami-Dade County Healthcare Preparedness Coalition. So the question, what role do hospitals play? I like to say this, as always, every road in a disaster leads back to a hospital. People get hurt, people need care. So the hospital really is kind of that beacon during a disaster. And for the hospitals, they need to be prepared because they will be getting an influx of patients. They will be seeing the community come in. People will need the help. So how do hospitals really prepare for all of this, right? Making sure that everybody is ready for coordination and collaboration. Like Pete mentioned, have that communication ready to go with all of your community partners. The disaster planning is extremely important, making sure that you're ready for mass casualties, for evacuations, for patient transfers, et cetera, et cetera. Resource sharing, because at the end of the day, hospitals can become isolated. Should there be a prolonged response to an emergency? We saw this with COVID, where the hospitals really had to be able to stand up on their own. That being said, during mass disasters like this, it behooves all of us to work together so that we don't feel like you're going at it alone. Now, making sure that you have all of your staff trained for any issues that can come up, training and exercises, doing tabletop simulations, full-scale disaster drills, incident command training. So hospitals really, like, what are the role that hospitals play in disaster readiness? They play one of the biggest roles, and healthcare coalitions help that by strengthening the preparedness for all of our hospitals.
Thank you, Marilia. So I know, and that was a great look at collaboration across systems, and she probably knows I'm moving over to her. Tamara, I need you to explain now from the frontline perspective, and obviously introduce yourself and explain your healthcare system, but how do hospitals plan for surge capacity? That's a recent term that we're using a lot now because we're in South Florida. Our NEDOC numbers, maybe explain what that is. But how do hospitals plan for surge capacity, staff continuity, and infrastructure resilience? Here at Jackson, I know I can tell you some of our buildings are over 100 years old. You're building and growing over at Baptist, so touch a little bit on that for us.
Absolutely. Thank you, Bridget. Good morning, everyone. And my name is Tamara Turk. I'm the Director of Emergency Preparedness at Baptist Health. So with Baptist Health, we're a large healthcare system. We have about 11 hospitals throughout the Tri-County area and Monroe County, and growing. So very grateful to be part of such a wonderful and growing organization. And also it helps us to be exposed to all these hazards that we're going to talk about during this webinar, and have those lessons learned in our pockets. So in terms of patient surge, I think the first step that we all take in emergency preparedness, as we all know, is to assess the hazards or the risks. So as we all know, we have a process in emergency management called, creating an HVA, a hazard vulnerability analysis and risk assessment. That's a fancy word for a risk assessment, right? And every organization, every business has to do that. So when we do that, at Baptist Health, and I think it's being done everywhere because it's best practice, you do it as part of a multidisciplinary committee. So, piggybacking off of what the Bridget mentioned and Marilia and Pete mentioned, you have to have the players in the room when you're doing this HVA, because you don't want to tell them, hey, this is what we need to be prioritizing. You need to hear from them. They are your boots on the ground. They are the nurses, the doctors in the ED, your CEOs, your executives that are in the hospital working day and night. So you hear from them what you need to prioritize. And part of that, patient surge always comes up. Now, we learned a lot of lessons from COVID-19. However, as everyone knows here, I'm sure on this panel, we're going through a patient surge right now with all of our hospitals. Our EDs are pretty much overcrowded. To what Bridget mentioned with the NEDOC score, our EDs do use that. And that NEDOC score is basically, and you can Google it and look it up. It'll show you actually the formula that's used to calculate the score. So if you use tools like Cerner or Epic, the NEDOC score is usually embedded in those electronic health record management systems, and it helps you calculate what your NEDOC score is in your ED. What that NEDOC score tells you is how crowded is your ED based on how many people you have, and what is the speed of basically making a bed available for those people that are in the ED, don't have a bed assigned to them. That gives you a good idea of where you're at in terms of a patient surge and whether you need to escalate and find extra bed space or not. And thank you for putting that in the chat, Bridget. So when we do that, I can tell you that the biggest piece of advice I can give in terms of planning for a patient surge, after you've done your risk assessments, after you've had those conversations with those with the multidisciplinary committee, is walk through your hospitals, look at the space that you actually have. A lot of spaces have been converted into offices or conference rooms, but they actually have those connections to be able to put patients in there. So grab your nursing leadership, grab your safety officer, grab your security manager, walk through your hospitals and find out how many patients you can put in each area and update your plans constantly, because when we're looking at patient surge, we have to consider, is it an infectious disease outbreak that we need to take into consideration, your negative pressure rooms. I can go on, but those are just the highlights of what we include in our planning for a patient surge.
Thank you. That was great. I'm gonna explain a little bit because this ties into what Pete, Marilia, and Tamara were saying, and then I'm gonna throw it over to Ruben. So a lot of people on here may or may not know the county has what's called a medical management facility, or MMFs. During times of disasters, hospitals actually house patients that are electronic dependent, ventilator dependent, or require oxygen. And during those times, we open up spaces in our hospitals that may not be typically bed spaces, but we've gone through, like Tamara saying, and identified spaces where we can allocate additional outlets that are hooked up to emergency power. That is one way that we become creative during disasters to care for our community. We work with the coalition on the hazard vulnerability analysis because there is a hospital coalition HVA, and that helps the hospitals then evaluate our individual HVAs. So before me at Jackson doing our Jackson Health System HVAs, we get together with all hospitals to discuss a hospital coalition HVA. That's one way that Miami-Dade Emergency Management helps understand the hospital risk. And then me on an independent level, I identify Jackson Health System's risk, and then Tamara at Baptist assess her risk. So this is one example of how health systems do it, but businesses also do this. Security systems have security vulnerability analysis. If you don't understand your vulnerabilities or gaps, then you don't know where you should be doing your training or where you should be allocating your funds to increase your resiliency. But Tamara did touch on something. When it comes to overcrowding, when it comes to surge, when it comes to mass casualties or training and exercises, she talked about becoming innovative, and that turns me right over to Ruben Almaguer because she's talking about internal readiness. But internal readiness is one thing. Sometimes you can't really do everything on your own. So I want to ask the private sector side, with particular focus to logistics and innovation, what role does the private sector play in disaster response and recovery when it comes to logistics and innovation?
Thank you, Bridget. Again, my name is Ruben Almaguer. I'm the CEO and owner of a company here in South Florida, specifically in Coconut Creek and Broward, called Forts Logistics. First of all, thanks for bringing the private sector in. Many conversations and many of the conferences that occur are purely focused on federal, state, and local entities, which are critical in the primary response, but without really utilizing, engaging the private sector, which really healthcare communities do it every single day. First of all, every single hospital, healthcare facility uses medical staffing, third party, medical equipment, medical consumables, pharmaceuticals, oxygen systems, generators, food, and so on. So every single day, we're already partnering with the private sector. The question is, what role does the private sector now play in response and recovery? And more importantly, what innovative ways? So first of all, we're not just supporters, we're core partners in these response and recovery entities. Again, I truly believe we can exceed the speed and scale many times that government, has many hindrances to be able to do that. There's much more freedom in the private sector to be much swifter, much quicker in the responses. So I'll just give you a couple examples. Recently, last year or two, we were asked, and it's not just about this company, many private sector disaster logistics response companies do the same thing, but HEA and Largo on the west coast of Florida had a hurricane impact on the coast there. They had significant flooding in their basement. Well, guess what they kept in their basement? They kept all their IT and network and power services in that area. And so they lost their entire ER and ICU area. So immediately we were asked to provide for them a temporary ER, a 10-bed isolation ER in their parking lot. But guess what? No power, no easy ADA access. How we're going to have their personnel and their staff have break rooms out there. So we really created a capability to, within a couple of days, to have a 10-bed ER, and actually stayed almost fully operational for about a month and a half until we actually could get them back up and running. So those type of innovations, including the ability to bring in oxygen systems, temporary oxygen systems that also were not available because the local oxygen serving companies, based on the floods and the disaster on the roads that were impacted, could not bring it in. So we actually brought in temporary oxygen filling stations for both ambulances and the hospital facilities. So those are some of the innovations that we bring, but it's not about just Forts, it's about other private sector companies that you already have in place to be able to consider utilizing for the future disaster when it does happen.
Thank you, Ruben. That's great. I know there was a discussion on, and there is always, and hospitals are always talking about oxygen redundancies, space, the ability to create temporary ER, ICU, additional bed capacities. That's something that we do on the federal side. Then there's the talk of, being able to use internal staffing, not needing to bring in federal responses. So thank you for those insights. Marilia, I'd like to ask you a question just because it's unique to South Florida. You work throughout the state. What lessons from other regions in Florida are most relevant to South Florida?
Sure. So, one of the best things that you have to understand is that you need to learn from other people, right? Disaster preparedness and response is something that unless you go through it, you won't really know what the motions are. So by looking towards other organizations that have gone through it, you're able to kind of imagine what the impact would be like for yourselves. So, for instance, how did other cities and hospitals prepare for and respond to disasters? Like think of Hurricanes Michael, Helene, Milton coming back to back to back in Tampa Bay. Learning from others helps us imagine the scenarios, like I mentioned. So, however unlikely, you are better able to prepare yourself for those situations. Like, sure, we think about a hurricane, but what are you going to do if you're in response mode and then you're getting hit again? So it didn't happen to us, but again, something we can learn of. What were the biggest issues? Like, was it staffing? Was it equipment? Was it being able to stand up for yourself for 96 hours and then doing a rapid turnover to then be again able to stand up for yourself for 96 hours? Things like planning. So Miami hosts a lot of large events and activities, but planning teams have a tradition of visiting a current host city prior to picking up the mantle for the next event as a way of familiarizing yourself with what's to come. We should do that. We should do the same thing and observe centers of excellence. This would require organizations to be open to share their plans, of course, which is where healthcare coalitions can step in to assist with that. Miami is so resource rich, but we can and should still learn from others, especially large metropolitan cities around the country. Recovery is another big thing where, we can learn a lot from others that have gone through it. So how do we as a community recover together? Organizations across the board cannot operate in silos. So I and our members are so grateful for the collaborations and partnerships that we have with the Department of Emergency Management, the EOC, ASF8, et cetera, to get us back to business as usual. That being said, our organizations need to have robust business continuity plans to be able to continue operating and thereby serving our most vulnerable residents. So yes, hospitals are the shining light post-disaster, but we need to work on getting to support systems back up too. So making sure that we have a collaboration with home health, dialysis centers, outpatient clinics, community health centers, and more. And by getting those services back online faster, the pressure in the chamber gets released for the hospitals.
Thank you, Marilia. So I think you kind of touched on it. I'm going to throw this to you, Pete. So how do preparedness intersect with workforce protection and business continuity? And on that, I think I'd also like you to touch a little bit, because I know you can talk to it, on what we're doing in South Florida to prepare for these mass gathering events, FIFA, F1, et cetera. Because I know our hospital systems, Jackson Baptist, are preparing and engaging in different training and exercise programs.
Yeah, that's a great point, Bridget. We've been actually preparing for a large scale event for World Cup, because World Cup is like something what's happening in North America has never happened in the world before. To have three countries and have the number of teams that are playing, it's never happened before. So the way we look at it in Miami-Dade County, we're looking at 40 days of events at the stadium, right? It's the stadium will be stood up for 40 days. We have 7 games. City of Miami has 23 days of FanFest activity taking place in Miami. So we're preparing to be activated and monitoring everything for 40 days. That's an incredible amount of resources that are going to be needed, right? Think about in terms of a Super Bowl. Super Bowl is a one game day. You prepare for about a week. The teams come in, they leave, and the community's done. This is the equivalent of 7 Super Bowls and then some. And the fan base is a lot more passionate than what we see with American football players, right? We are fortunate that we have large events all the time, right? Gaia Ultra just passed. We have Ultra Fest. We got Super Bowls. We got concerts left and right. So our first responders, the sheriff's office, local police, fire rescue, have a lot of experience in those areas of preparedness. But also the preparedness part is, you mentioned it, is that resiliency, right? And continuity of operations, right? You have to be ready if something happens to your infrastructure to be able to continue to operate when things happen. And I always tell people, when I came from the fire department world, Ruben and I both came from the fire department world, and I would always tell people, if I train my firefighters and got them ready, I don't care about the public, because we're going to take care of them just by having my people ready, right? And that's what you got to do as an administrator, a hospital system. Have your people ready. Create a continuity of operations plan, follow it, drill it, exercise it on a regular basis, because a plan's no good if it just sits, in a desk somewhere or a shelf somewhere and it collects dust. You gotta practice it, And to the points that Marilia was making about places that we travel to, she's right. We are so resource rich. We are spoiled, right? And I try to tell everybody, listen, we haven't had a disaster in a long time. Everybody wants to point to Hurricane Irma. Hurricane Irma was not even a Category 1 hurricane. And we lost 2 cranes in downtown Miami. We had $100-something million worth of debris in Miami-Dade County. The city of Miami had like 70 million, and it wasn't even a Category 1 hurricane. So when we talk about these things, remember, we haven't really had a big time disaster in a long time. The last disaster that we had, and by the way, it doesn't even register as a disaster, even though we got presidential declaration, was a Surfside collapse, right? And that was confined to a very small area, and it was handled by USAR team. So it didn't tax our resources at all. And that's the last really disaster that we've had.
So I think that's also kind of what makes it difficult for people to engage maybe prior to. I always say, don't share business cards during a disaster. And I think those of us in the field have always said that, right? So Ruben, how can healthcare and business leaders better partner with the private sector before a disaster? And kind of what are you trying to share in terms of logistics and innovation in order to get them to understand the importance of that, like oxygen continuity, mobile hospitals, or just expanding some of these projects in innovation if they can't think creatively because they're working within the confines of what they have or trying to expand within their 4 walls?
Well, I think already hospitals do this to some extent, right? I would assume it's sort of the requirement for some of their accreditation to have redundant backup networks in place for some of the critical areas. But I think that needs to be constantly looked at, because it's easy to have on a piece of paper a vendor you have a contract with, but you don't know if this vendor's got 39 other contracts in South Florida as well, doing other things. And so it's beyond just having the contract. First of all, I think you have to make a couple practical steps. I'm one of these where, it's the classic Reagan trust and verify. And I expect every hospital setting, and even pre-hospital provider should do the same thing. Whatever organization and company that you have to be your primary supplier, you probably need at least two more backups. But I'm going to say the hard thing. You guys had never been to their company headquarters. You've never been to their warehouses. You've never met the owner. You don't know these people. They're not going to pick up your phone call on Christmas on midnight. So I think, some effort needs to be put on to develop relationships with those critical companies that you're going to rely on, that you give them a lot of money every single month, every single year. But when you need them, they don't have the personnel, they don't have the raw material, they don't have the transportation means, they're already overtaxed, they don't have the inventory. And so, guess who they're going to help out? The person who they probably have the closest, reliable, trusted relationship with. If you don't have their cell phone, generally the rule, if I can't speak to the owner of the company, I want to find another company. And so you do need some large global companies to work with, right, in the industry that you're in. But I'm also going to tell you, you should consider some mom and pop shops. And whatever you do, again, you got to play the game of geographical challenges, because these companies also get impacted by storms and they're employee driven. So without their personnel, you can't do anything. So whatever product it is, pharmaceutical, medical supplies, oxygen, hospital beds, and so on, I would say encourage you to have a West Coast, East Coast, and then a couple small and large companies that you can actually already have pre-vetted, visited, and have contracts with, to at least have some sort of comfort, because the reality is they're going to fail you.
100%. So a term that we use, in the hospitals, not just for accreditation, is, do you just have a sole source vendor? You need to have multiple vendors. But for those of us that have been doing this for a long time, we know that you got to be able to have that cell phone number and the relationship of a person. You've had coffee with them. You have a relationship with them, and yes, they have to be able to pick up the 3 a.m. phone call. That's 100%. I'm going to move it over to Tamara and ask you, how then do your systems balance preparedness investments with day-to-day pressures?
That's an excellent question. I think everyone may relate to this statement that I'm going to make, and I'm sure we've all heard it. I've heard it ever since I started my career with EM, is that sometimes EM is overlooked because we're not revenue generating. It's a challenge that we always have to talk about, or to solidify our presence or justify why the program is so important. And a lot of that comes from, okay, why should the organization dedicate a lot of money to have those plans in place, those agreements and MOUs with external partners? It's very, very important. And so the conversation that we always have, and I know with large healthcare systems that may not be an issue, but a lot of smaller hospitals, they're limited in terms of funding. How do you do that? Well, when you have those conversations, emphasize that we're doing this because it's important for business continuity and to continue patient care, which is our number one priority, is to keep our patients safe. B, we need to keep our doors open by remaining in compliance with Joint Commission, with CMS, with AHCA, the Agency for Healthcare Administration. So in order to do that, you need to have those redundancies in place. They're going to look at those agreements that you have. And like Ruben mentioned, it's not enough to have just one MOU for water or for fuel. You need to have a backup and a backup to your backup and a backup to your backup. It's the more the better. And so what we do is we focus on dual use investments. So obviously it's a requirement to have generators, to have fuel, to have food, to have water, to have network resiliency. Those are all requirements. So making sure that we capitalize on that and add redundancies to those, using real events as learning opportunities. So when we document real world incidents with thorough after action reports that again include your multidisciplinary committee, that agree to your after action report, that agree to your improvement plan and what it highlights. Okay, this agreement that we had with our backup generator did not come through. So let's look at pursuing other vendors, maybe vendors that are in North Florida and not in South Florida, because they're going to be helping other organizations that are also your neighbors. Looking at, so prioritizing your after action reports, and then taking that risk-based approach with the HVA that I mentioned earlier, leveraging regional partners. Coalition is a great example, working with other local partners like Department of Emergency Management. A lot of those lessons learned, organizations like DEM and Coalition through Marilia and Pete can give you those pointers that can really help you be extra resilient. And then that will help you maintain your overall operational efficiency. And one thing I will say is that an example that we use at Baptist is we do have an MOU with a vendor that can help us be extra resilient for redundancies. However, the funds that we allocate to this MOU don't necessarily say in case of an emergency, the vendor agrees to provide us, X number of pallets of water. We actually purchase whatever we're agreeing with this vendor. I'm going to use water as an example. We actually purchase the water beforehand. Yes, it's stored in their warehouse, but we own that water, whether we use it or not. If we don't use it, fine. I mean, we'll lose out on that. But when something happens and we do actually use it, that investment pays off. So that's another way of maybe negotiating with our vendors and our partners to kind of tweak those MOUs, and instead of just reserving the water in case of emergency, you actually purchase it and then you can use it. It's guaranteed that you'll be delivered that. But again, making sure that you have agreements with other organizations that are outside of your region to make sure that you're redundant in case of an emergency.
Yeah, Bridget, can I make a point about that point right there? So if everybody remembers, was it last year or the year before, the flooding in Fort Lauderdale, what it did to our supply of gas supply? Well, that's a great example of why you need to have other contracts that are outside. The state of Florida has additional contracts. So if Tampa gets affected, so our main ports for fuel are Tampa and Port Everglades. If we get affected again, we can go to Texas and Louisiana and bring oil and diesel and gas from those sites. That's a perfect example of having that redundancy built into your plans.
I think the other important thing, and she hinted on it but didn't officially say it, is the first slide that we put up before we began the panel was a shift from response to resilience and the inclusion of operational tasks to leadership priority. HVAs now require through accreditation agencies that leadership or C-suite or executive leaders are included on the HVA, and that they also sit in on multidisciplinary committees. If this sounds like a foreign language to you, what we're basically saying is when you start analyzing the risk of your businesses, your practices, this could be a meeting, with your leadership that is saying, we're going to talk about what we think our gaps are. You can't have those meetings in silos. It can't be one person identifying the risks of your business. So personally for us, we included in a multidisciplinary committee that we call the Emergency Management Preparedness Committee, and all COOs of all the hospitals are included, as well as, our cybersecurity, our public safety, IT, nursing, pharmacy, blood bank, respiratory. That's for a hospital, but you can take that concept and move it into business. You can move it into real estate. You can move it into logistics. What it matters is that all leaders are there making a conscious decision and providing their input. And then she mentioned after action reports. When an incident does occur, the debriefing of that incident is being done again in a multidisciplinary fashion where we all are going through not just opportunities for improvements, but also strengths. What went well? How did we respond? So there's some reactionary efforts of what happened. How prepared were we? How did we respond? Did we respond well? Did we have the right resources from operations, logistics, planning, response? And then go through the potential corrective actions. What do we need to improve upon, and who's the responsible party for going through this? Once you go through that, then it's not just, this one person's responsible for fixing all of these problems. No, it was done in a multidisciplinary room where now a leader is signing off on, for us personally, I have the COO of the facility sign off on the after action report. Now I have buy-in in emergency management. So from the hospital level, that's how I ensure that when I need that investment, or when I need that tiny little bit of capital that I end up begging for, that they understand that we do need that. So I am going to say, and I am going to pull it over to Ruben, where I say, where do logistics and supply chain breakdowns most often occur from what you see, and how do you feel from the private sector it can be mitigated? But I'm going to ask the very same question right after to Marilia, because she hears it throughout the state from the coalition perspective, and I know you're in on the Florida Hospital Association meetings as well. So to Ruben first for logistics and supply chain breakdowns.
So really the primary two choke points that I think, are pretty common out there. Most of you may already know. First of all, it's the third party private sector, supplier failure, right? We expect that everybody can perform, but the reality is they also have people and they also have buildings that require power, and they also have impacts of tariffs and raw material and lack of inventory, and they've also been impacted by by disaster that may not even be in your state, that you may not even be aware of. They have IT network failures, or they just have overwhelming demand. So ultimately, I'm going to tell you, it's always about this vendor who most people don't produce everything. So they have subs to subs to subs, and the most you'll ever see is that first tiered prime vendor that you're reaching out to, but understand that that prime vendor is relying on a lot of other companies and organizations to support either the specific product or person that you need. So that third party private sector vendor is one. Really the best way, and I think even, Pete emphasized that again, is listen, we have to have redundancies, okay? And I mentioned a little earlier, use other companies, backup vendors, small mom and pops, large organizations, East Coast, West Coast, and as more time and effort you can put on identifying these people that you rely, know, and trust, the better. And really the second choke point is transportation failures, air, sea, or ground. Well beyond your control, but the one thing you can require in contracts is ask for real-time resource tracking. Then dealing with it's going to be here tomorrow. It's going to be here tomorrow. It's going to be here in 6 hours. It's hard to do that on the air and the sea as much, but ground shipping, it's pretty common today. You can have full access on your phone and your computer on the product and the contract that you got in place that you want to see live, where that truck is and the status of it at any given time. So if you haven't built that built it into your contracts, because it's critical. So those are pretty much the two choke points. I think AI these days, and we haven't talked much about it, is providing a lot more reliability and information on that second choke point, transportation, to find better ways to reroute and get you those products through other avenues. If they can't bring it to you, then you have the full authority and ability as the customer to get your own product from that customer or from the vendor.
Thank you, Ruben.
So for the question, how do logistics and supply chain breakdowns most often occur? And Ruben is correct. All of these companies that you rely on have their own issues that they have to work through. We think about an organization that we all had to use having a cybersecurity event just a few years ago, and that being the supplier for 90% of our hospitals in the area. How do you overcome that? You do that by being creative. I know Jackson and UM, for instance, they hosted their own creative solution and now have incorporated that solution as a backup to the backup moving forward. We talk about cybersecurity a lot because that is a massive issue, but as a hospital or a healthcare organization or just an organization in general, how do you isolate yourself from that? You do that by incorporating language in your MOU where you can have a better understanding of how these organizations themselves prepare. So making sure that your preparedness is pushed through to other levels as well. And that can only be done by having those great conversations beforehand. How can you mitigate all of this? Like I mentioned, we talked about doing some creative solutions, but also making sure that diversification is done 100%. One of the issues that we had just a few years ago was an IV solution that we could not get because the factory had an issue with a hurricane that not necessarily impacted us, but for them it was a massive issue, massive delays, huge ripple effect that went through, and everybody was kind of scrambling. But coalitions, healthcare coalitions, organizational coalitions, they were able to get together and say, all right, where can we get this solution from? How can we extend beyond the one organization that everybody is relying on, the one vendor that we're relying on? And you do that by reaching out to all the other coalitions across the state, across the country, and you come up with a solution. And that is the most important thing about healthcare coalitions is by making sure that you have those conversations, that you have those relationships so that we can be your force multiplier for you. So it's really important for you to get involved with your community so that you don't isolate yourself from any issues that come up.
So Ruben, thank you very much, Marilia. Ruben sort of touched on it a little bit with artificial intelligence. There's been mentions to cybersecurity. I am going to say it, Stryker. If I say that, you guys all, yep, I said it. Let's nod our heads. It happened last week. Luckily, I know our healthcare systems, our firewalls were able to block it. We were all very resilient, right? But there were some supply chain slow gaps because of it. Why? Because it impacted Stryker and they carry medical equipment to the hospitals. We all know in healthcare that cybersecurity is our number one sort of threat, and it's just a very well known from outside actors. So with that being said, when it comes to our 96-hour plans, how we can become more resilient, that comes into play in asking ourselves, if this goes down, then what? If this is down for this many hours, then what? I see Evie here in the chat has mentioned Puerto Rico and how difficult it was for clinicians to function on paper forms. I'm a nurse practitioner. I've been a paramedic since I was eons ago. And I don't know that a lot of clinicians now know how to function on paper forms. That's something I know Tamara and I can talk to. That's why when we do our training and exercises, one of the things that we input, and Pete can talk to this, is moving into exercises where we say, this just went down, then what? That's moving into the continuity phase of building everything into during this disaster. What if electronic health records go down? What are your core components? Not just electronic health records. I'm talking also now about biomedical equipment, having downtime procedures for biomedical equipment, asking our continuity officers to take a look at continuity playbooks. We call them playbooks, and those need to be inclusive of the departments to be working on. So we work at the departmental level clinically, and then that phases up to the emergency management department. And then in the emergency management departments, we work with the coalition. And something that Marilia hasn't mentioned, but she does have up her sleeve, there are resources on the coalition websites that have preparedness plans and response plans should individual, businesses or hospitals not know where to start. And then the Department of Emergency Management for Miami-Dade County also has resources for individuals that need them. So I am going to ask the question, because there's resources, but what if there are significant gaps? Pete, what do you think has improved in recent years, but where do you think the gaps still remain?
Improved, I mean, to me, that's simple. Bridge, it's the collaboration, right? When I became a fireman, we never got together with with police, we never got together with the hospital, we never got together with the healthcare coalitions. After 911, all that changed, right? We created the Regional Domestic Security Task Forces and the whole Domestic Security Oversight Council structure in the state of Florida kind of like brought everybody together. So we drill, we exercise. I mean, I know most people on this panel, I got people that are texting me or sending me messages that are participants that I know. And I always say I get more accomplished with this, right, than that whole NIMS ICS thing. Shh, don't tell anybody I said that, right? And it's because those relationships that we build, right? Just for World Cup, we have brought in over 120 exercises, trainings into Miami-Dade County, getting ready for World Cup. We've done 25 exercises, right? Either full scale, tabletop exercises. Some of them are huge. recently did a cyber tabletop exercise, was had great participation from law enforcement, from CISA. I mean, it was awesome. So I think this collaboration that we see is one of the best things that I've seen in years because everybody knows each other. We know who to call. We know, what you can bring to the table and help us with the medical coalitions, the healthcare coalitions are amazing because everybody works together. You have, meetings all the time. Everybody talks. Everybody knows one another. So to me, that's amazing. And Bridge, what was the second question? At my age, I forget those things.
No, you don't. It was where do gaps remain?
Wow. Well, I think right now, well, take a look at the geopolitical climate that we're living in, right? I think that's a big gap, especially for folks on this call that are healthcare professionals, that are scientists, that work on science to make decisions. Uh, and sometimes you run into political reasons why you can't do certain things, or you might want to do it, and you're contradicted by somebody at a higher level within an organization, state of Florida, something like that. So I think those are gaps, Bridge, until everybody gets together and says, hey, this is what we all need to do, right? Because when an event happens, there are some organizations that are the lead, right? They're the lead ESF for whatever it might be. In your guys' world, the health departments, the Florida Department of Health is the lead agency if there was to be another COVID or any other pandemic or endemic that might come our way. I think those are big time problems. And the other thing is, I tell people, don't forget, the past threats that we still face, because you see homegrown violent extremists, they pop up all the time. Now they have, they have ideologies with Islam. They're still out there. There's cells all around. So don't forget that part of it. So I think people need to remember that as you go and you work and you build your plans, don't forget all the threats and risks that we face still.
Thanks, Pete. So tomorrow I'm going to ask you a question, and it's one that I think you can answer authentically from a visceral place. If you were to give advice to a new emergency manager that's starting out in preparedness, what are some golden nuggets you would give them beginning their adventure here in South Florida?
I love that question. I'm gonna say reiterate what Pete said, that when he picked up his phone, building networks, making friends in the community. If a coalition puts on an event, go to it in person. If there's a symposium or an event that brings in all these people like RDSTF, go and network and collect phone numbers and make relationships. What Ruben mentioned earlier, when you want to have agreements with those vendors that are going to save your organization's business and your patients, meet with them, build a relationship, build a solid relationship. And when you have that solid network in your back pocket, you will be set for life. I mean, emergency management can be taught. You don't have to go into this career with a lot of experience. I mean, it helps, but for me, I didn't study EM in college or university. I have a master's in public health, and it relates. But just know that you can be successful in being an emergency management professional by just building your networks, making sure that you are building off on that resiliency, going off of your compliance with Joint Commission, DNV, ACA, whoever you listen to. But building networks is my biggest piece of advice for sure.
So I noticed yeah, go ahead, Maria.
I actually want to jump on something Tamara said about being able to grow in the organization regardless of where you came from. I come from an education background, right? I had no idea what emergency management really was, but when you come in and you put the effort in, it makes it a lot easier. Most of my job is picking up a phone and calling someone, having that personal connection with my members so that they know that they can call me for anything that they need. I've had people call me at midnight saying, "Hey, Marilia, we're having this issue right now. Are you able to help?" And then you have to commit to being there for them. What Pete said about what the biggest gap was. My biggest gap that I see is complacency. It's we haven't had a disaster in a long time, but being complacent is to me the largest gap because I've seen so many people have turnover and people come in and new and say, oh, well, this is how it's always been done. Don't do the things that how they've always been done because they obviously will not work in this new age. So making sure that you're constantly reinventing yourself by being connected to others, by seeing what everyone else is doing, and taking those lessons and really formulating your own plan. I think that those are incredibly important strategies. And those are things that, again, you don't necessarily have to learn, but you have to be willing to take on.
Yeah, Bridge and Marily is absolutely right. When Ruben and I were both very instrumental in the urban search and rescue programs, and in Hurricane Katrina, I went to Mississippi, and everybody that we ran into that survived, right? We asked them, and the stories were horrendous. The things that people went through, it was always the same thing. We lived through Hurricane such and such, and we didn't think this one was going to be as bad. And I always tell people every weather event is different. No two are the same. Even a storm that doesn't reach category 1 still has tornadic activity that can destroy a neighborhood, a home, a mobile home. So people need to keep that in mind.
I think, there's a lot to say about the way in which South Florida communicates, and it does start with networking. And those that are successful, they have good networks. They attend the coalitions, the Regional Domestic Security Task Force. And even then, being transparent, I think that there's a lot that can be done because for those on the call, the Regional Domestic Security Task Force is a quarterly meeting in which not just emergency managers, but public service, security, terrorism liaison officers, the Miami-Dade Sheriff, Broward Sheriff's Office convene to really share insights. So you go and there's a meeting where there's a broad meeting where we all join and get a briefing, and then we break out into breakout rooms. To be honest, I think the breakout rooms can even mix more. You should have emergency management and the health sector and the sheriff's office kind of sitting and meeting. I really would love to see that in the future because I think that's exactly what we're kind of doing right here, talking about resiliency. And that leads me kind of like into my next question because we do see this. This is Miami. How, and really it's free for all of you to kind of answer this question because I know we all deal with it. It is South Florida. How do you manage competition? And what does a bad partnership during disaster look like?
Well, let me say one thing because I think the competition you mentioned, I was going to talk about shared inventories. So one of the most important things, and it goes really, it's a competitive edge. Obviously, there's for-profit, nonprofit, and then there's state and county run medical facilities all around Florida, including South Florida. So if you treated this as a pure EM, law enforcement, fire service, we have mutual aid compacts. We have state, EMAC compacts where the first thing we do is we run to our sister organizations. So, I would challenge the healthcare facilities, do they actually have the relationship and the trust enough in this shared competitive environment, which it's all about, a patient bed being filled. Are you willing to share? What do you got? What's your stuff? What are you willing to share that your leadership is going to allow you to share, that you're willing to offer up to somebody else, knowing you still may need some of it. But those shared inventories are I think, very valuable in developing not partnerships just with the government or the private sector, but within your own, healthcare industries of hospitals and medical facilities and clinics. Hey, this is how much extra capacity we have in a warehouse, 100 extra ICU beds. We have unique abilities that we own our own generators, and we could probably share some of that stuff for you and reduce your cost of having to rent or buy something in an emergency. So that competitive edge could also be turned into something very positive where everybody's going to really rely and trust and do that with each other. Recently, just to give you a little insight, we met with a company you may know called Zoomro, right? It's a tent-based inflatable company, well known. We didn't know they're literally 10 miles down the road from us. And so we sort of said, let's meet with them. We're not in the same exact business as they are, but we don't want to buy them. They're not going to buy us. We are still do structures together. There's some opportunity to collaborate together. And we spent 3 hours in their warehouse, saw everything. They came to our facility, met with the owners. They saw a lot of our stuff. And because of that, we got over the angst of this competitiveness, and now we're actually signing an agreement to partner jointly because we provide two different type of similar services, and I encourage hospital facilities to do the same.
100%, and I think that's extremely valid. It's and I know just to everyone on the call, I'm relatively new to Jackson Health System, and Tamara Turk from Baptist Health, and Vince Torres from University of Miami, and Evelyn from Nicholas Children's. I mean, the local hospital systems have really been very well receiving to me at Jackson, and I found that through the hospital coalition in Morelia, obviously, it's been lovely because the reality is that when disasters do hit South Florida, we are all in it together. And I think that something that we see here, and I'm just gonna sort of recap what we have been talking about. There is a lot to talk about in terms of regional coordination, public leadership, engaging leaders. It's essential in order to be resilient, in order to have that business continuity. Business continuity isn't just a cybersecurity function. It really is important for operational resilience, engaging the private sector logistics, and keeping our mindset open into innovation. It's not just a robotic discussion. And knowing that in South Florida, we really do, we are lucky, we are resource blessed, but you need to be able to train, educate, have those sort of discussions on what if this did fail? What are your downtime procedures? Knowing your gaps, knowing what you need to do in order to kind of exercise those things. For me, I think those were sort of my takeaways, but I would like just a 1 kind of minute round robin, last sort of motivational quote from the team on what they would like to leave you with. Pete?
You want us to speak, or you're going to call on us?
Pete, just real quick on if you wanted to leave anybody with something.
Well, I think they're already doing it, Bridge. The fact that we have so many people on this call and participating in this webinar is important. Like I said, years ago, we never saw this. It just didn't happen, right? And now here we are, and God, I don't know how many people are on the call and asking questions, good questions and stuff. So I say keep it up, especially the executives that are not on here. Tamara, Marilia, you guys keep up the good work, especially you, Tamara. I know who you got to work with, so I feel sorry for you.
Appreciate that.
For me, the most important thing is get out and meet your partners. Get out into your community and meet the people that rely on you, but also you rely on, because they'll help you out in a disaster.
I'll leave everyone with this preparedness. Just keep thinking of preparedness as not separate from operations. It's how you protect your ability to deliver care every day and under stress. And remember, it's never a bad thing to be a negative Nancy or a little chicken saying the sky is falling. That's our job. So make sure to keep doing that and keep up the great work.
Yeah.
Thank you.
And I'll close it by saying, prepare your replacement. Because this is an industry where one day you're sick, one day for political purposes you're gone, or you win the lotto. There's a lot of knowledge and experience that you're going to leave behind that no one will be able to carry that mantle. So I think we have the moral, ethical responsibility to prepare those future leaders to replace us. And that also means to encourage us to bring in interns in the field of public health and emergency management into our organizations to help prepare them, work with local universities that prepare people in the healthcare industry, as well as in the emergency management field like FIU, Barry University, University of Miami. Collaborate with them because I think there's some huge value in preparing the future leaders, because someday, probably within 5 years, none of us will be on this panel. And there'll be other people that hopefully we had a little role in preparing and mentoring to bring them up to speed faster than it took us to get to our level.
Great point. I'm going to hand it over to Evelyn and just say it's been such an honor to moderate this panel. Thank you so much.
Thank you so much. What a stellar panel, and thank you so much for your expertise. It really means so much that you've taken the time to share your expertise, your knowledge. We have several questions. I'm going to try to summarize them and sort of group them, but one speaks to cross-sector collaboration. It was addressed to Bridget and Pete. In the event of a big disaster, if the public sector cannot respond effectively, how can the private sector respond and get over the red tape? How is procurement done? What does the private sector approach to offer assistance? And I'm going to just add a little bit more. I know it's a lot of questions, but these are related. Private sector companies have hundreds of disaster response mitigation management technologies. And is the county hospitals, both private and public, open to piloting projects to test these solutions? So again, the collaboration with the private sector. Bridget or Pete, would you like to add?
I responded to them, but when a disaster happens and there's a declaration either by the governor, the mayor, or really the federal government, the president, it releases the handcuffs on purchasing, right? Then you can almost, it's not a free for all, but you can purchase a lot easier. You can get whatever supplies, get contracts in place a lot easier than we can right now. So I always say during a disaster is almost the easiest part, because I can just call Ruben and I tell him, hey, I need 100 forts. I got to build a hospital for me. That's the easy part. And what was the other question?
So it talked about technologies. So there's technologies available. I know that cost can sometimes be a hindrance, but anything you'd like to elaborate on that?
Well, we in emergency management are constantly looking at and instituting different types of technology. What we have now is not what we used to have, right? As far as mass communication systems, situational awareness tools like WebEOC, things like that. We have different things, damage assessment software that we constantly look at. Again, as I mentioned in the chat responses, sometimes we're limited by a budget. So that's from an emergency management perspective. From a hospital perspective, I'll let other folks chime in.
I think technologies are, we can be really interested in something, but it does need to go through cybersecurity. We have cybersecurity officers that will say, that's great, but so sometimes there's some complexities with it working with our systems. I know Tamara and we would like to implement, certain things, but how well it works with the system, how well it merges with other systems, sometimes in disaster response, not just for hospitals, the easeability of the interoperability of things also is something, you won't purchase something if it doesn't work with other systems, because then you're sort of shooting yourself in the foot. So I think newer technologies are coming out and are working well with other systems, and things are advancing all the time. Part of being resilient is that the easeability of things, and things are getting much better.
I know we're coming to a close, and I'll close with two of the questions actually, and it really came from Deborah, and it was about education, consumer awareness, any mailings that are sent to the general public for the purpose of informing them about emergency preparedness, any do's and don'ts. And it also speaks to some of the resources that we've shared with you. We have a literature review, but we also have some great practical insights that Bridget and the team have shared. There's a QR code here on the screen, and you can access those resources. But if the panel would like to share anything related to, again, the education and information to the public.
So for us, the coalition has all of our resources available on our website. Anybody can just go on to our website. It's www.mdchpc.org. But for the greater public, the county does this fantastically. They send out a huge flyer every year. They have it available at Publix. They have the app available for Ready MDC. So a lot of the infrastructure is already in place. It's just a matter of making sure that this gets told to people to actually look up, right? Because as many resources as you can have, unless someone is actually trying to find the information or open to the information, it's just going to be another piece of paper that's available.
Well, we have come to the end, and I want to thank you again. Thank you, Bridget. Thank you to this esteemed and just such knowledgeable panel. Appreciate all of the great insights that you've provided. I appreciate the active engagement from all of the attendees. Thank you for joining us, and have a wonderful day.